At the Smith Institute for Urology at Lenox Hill, we're experts at the surgical care for kidney tumors or renal cell carcinoma. In the old days, prior to CAT scans and MRIs, when people had kidney cancer, it typically wasn't picked up until the kidney cancer was quite large. They could have pain, they could have bloody urine. It was kind of a different thing. If you've been diagnosed with a kidney tumor, your urologist at the Smith Institute for Urology at Lenox Hill will sit down with you and look at your CAT scan or MRI. From that scan, we can typically tell if the tumor looks suspicious. We typically have to evaluate the tumor by its size and its location. In many cases, we can simply remove the kidney tumor and spare the rest of the kidney. That's called a partial nephrectomy, and we're very much experts at that. I was incredibly fortunate to train with the first surgeon in the world to take out a kidney laparoscopically. And as laparoscopic surgery has evolved to robotic surgery and single port robotic surgery, we're able to perform the most complex partial nephrectomies imaginable. It means that we can spare your kidney if it can possibly be spared. Other times, because of the size of the kidney tumor and/or its location, it's best to take out the whole kidney. That operation is referred to as a laparoscopic or a robotic radical nephrectomy. We use small incisions to operate on the kidney. The tumor is removed and the kidney is reconstructed. Typically, this operation is about 2 hours. Most patients stay one night in the hospital and go home the next day. Once you've recovered, typically in a matter of weeks, you'll go on to live an entirely normal life. A portion of the kidney can be removed and you won't know the difference. Essentially, there'll be no limitations or changes in your lifestyle. So most often, even when an entire kidney needs to be removed, you'll be just fine because we have two. That's why patients can donate a kidney to a loved one if they're in need. You can live a long, healthy life with one kidney. For most patients with kidney cancer, surgery represents a cure. You have the operation, you go on with your life, and we get scans every 6 months and then every year to make sure that there's no signs of recurrence. For some patients who have larger tumors or more aggressive tumors, we work in an interdisciplinary fashion with our medical oncology team and provide state-of-the-art care with immunotherapy and other systemic treatments to push towards cure.